This is a patient of mine, and she originally is from Denmark, correct?
Right.
And you came in my office, and what was your symptoms, or what were you having as a problem?
Well, I thought I had gout. I was in big pain in my foot. I had neck problems. I have knee problems, among other things, but these were the most.
What about things you couldn't eat too? I think you told me that you had problems when you went out to dinner, or you ate things and you had, what was the outcomes of those when you ate certain things?
Well, I have problems with my esophagus. The food would stick in my esophagus, and I thought I had gout, which then caused my extreme pain in my foot, like tomatoes, white wine, just certain foods I couldn't eat at all.
Okay. And then when you came in my office, you explained all this to me, and we did some things, and we didn't give you any medications or anything,
No,
did we?
no medications.
So what I found out was I checked her neurologically, and I also checked her utilizing applied kinesiology and functional neurology, and her flexors were all weak on her system, and her extensor muscles weren't firing right. And so her stability was off, but her feedback mechanisms too, from her muscles back to her brain, weren't activating properly. Also, in utilizing applied kinesiology, we look a lot at what's called cranial therapy too. And her frontal sphenoid was actually in a situation where it was not, the motion was compromised and it wasn't functioning right. And when you study this, you learn that that inhibits certain outcomes neurologically. And so her digestion was off, her parasympathetic nervous system was being compromised, and her stability was off too. And so by activating and doing cranial therapy on her and doing some of these SOT techniques, in one visit she started having peristalsis, her digestion got better, her muscles started firing better, and the outcome was today that when you came in you told me, what'd you tell me?
Oh, I feel great. I have not felt better for the last probably 5 years at least.
And you were able to eat some of those foods?
Oh yeah, I went home and ate everything I have not been able to eat for years.
And your medications, you've somewhat decreased them too.
Oh,
I didn't tell you to take them.
No, you did not, but I just thought it wasn't necessary, so I just stopped some of them. Yeah.
And her stability is much better now, and so we'll treat her a few more times and give her things to do at home, but by actually what we call turning switches on and making her body function neurologically and her musculoskeletal system work better, her neurons and things in her brain that control this are actually working better, and she's going to be able to function better, and life will be better for you.
Oh yeah, can I just show you how much my knees are better?
Yeah.
I was able to go that far, okay? Look how far I can go now. I've not been able to do that for probably 20 years.
I told her she should start taking lessons doing the tango or something. Thank you.
You're welcome. Thank you very much, Dr. Stephen. It was awesome.